Hi everyone, this is Juman Gder. Today I'll be presenting the research entitled The Lasting Impact of COVID-19 on Surgical Education from the Perspective of Surgical Residents and Consultants in Saudi Arabia, a nationwide cross-sectional study. The objectives were to investigate the lasting footprint of COVID-19 on surgical education from the perspective of surgical residents and consultants in Saudi Arabia, to evaluate the perceptions of changes made in surgical training during COVID-19 pandemic, and finally to compare the perceptions of residents versus consultants regarding COVID-19 impact on the local surgical training. During COVID-19 pandemic, many countries have restricted the surgeries and allowed only urgent ones to be performed, whereas elective surgeries have been postponed, which results in less available learning experiences. Residents' hands-on skills can be significantly affected due to the reduced exposure to elective surgery cases. Since the start of COVID-19 pandemic, many precautionary measures have been set to curb the transmission of the virus. That has led to changes most notably in surgical education, like lack of surgical exposure and clinical activities. However, the question aiming at the impact of changes made by COVID-19 pandemic on surgical education and its extent remains unanswered. Speaking of methods and materials, the questionnaire was structured based on the available literature with similar objectives and adapted to our local terms. Questions targeted program preparedness, response to the pandemic, COVID-19 impact on the program, disaster medicine training, and virtual curriculum component. The IRB approval was obtained from Kmark Institutional Review Board. The survey was distributed online via social media applications to surgical residents and consultants working at primary, secondary, and tertiary hospitals from all over Saudi Arabia. The data were collected from the 6th till the 21st of July 2021, after COVID-19 vaccines discovery and arrival, and after the start of national vaccination campaigns. The statistical analysis were done using SPSS. Here are the results. So we had in total 243 surgeons. Most of the consultant surgeons were working in secondary hospitals with more than 10 years of experience, and the most common specialties among them were general surgery, cardiothoracic surgery, and orthopedic surgery. Speaking of the resident surgeons, most of them were working in tertiary hospitals with equal to or less than 5 years of experience, and the most common specialties were general surgery, obstetrics and gynecology, and cardiothoracic surgery. 66% of the surgeons strongly agreed on the importance of a training for infectious disease outbreaks. 40% of the surgeons expected a negative impact of COVID-19 on their operative skills, and 44.7% and 48% of surgical consultants and residents showed their willingness to respond to the pandemic regardless of its severity. So this graph shows you the concerns of surgeons during COVID-19 pandemic, and as shown here, you can see that families' health, safety, and preparedness was the most common concern among both surgical residents and consultants. When we asked the surgeons about the important virtual curriculum components, consultants preferred online practice questions, while residents preferred access to surgical videos. Simulation was ranked the best method for disaster medicine training. So in conclusion, COVID-19 pandemic has obviously impacted the educational environment of surgical training across the world. It has taught us that former means of education and learning have to be adapted to the new changes. Addressing the concerns of both residents and consultants, followed by implementing new components to the surgical education, is critical. So we recommend adequately exposing our residents and consultants to disaster medicine training, improving the virtual curriculum, enhancing their well-being by offering psychological consultations, and finally alleviating their concerns over their families' safety by prioritizing their access to immunization and treatment. Here are the references.